over the years, I've had some really good GPs. I have to say, as a larger person, you sometimes have to work quite hard to develop a good relationship and make it clear that you're not going to have every complaint written off as just, well, that's to do with your size.
Everybody in life has ongoing struggles. Yours happens to be your weight. Other people have different struggles. So we just have to be compassionate to each other. Tracey, I'm delighted you're able to join us today, and thank you very much for agreeing to sit down and talk to me.
Thank you, Martina. Thank you for the invitation.
So for anybody listening who doesn't know Tracey, I'm going to give a little overview and you can correct me if I'm wrong. So you're a bariatric consultant, a patient advocate for people of size. You're also you give independent advice to a variety of companies on plus size equipment, and you provide training and mobility for people of size. Am I right there? Have I covered everything?
Pretty much. I have a full-time job as well, but talking about things that affect bigger people is my passion. Obviously, it affects me. For anyone who's listening, I weigh probably around 200 kilos at the moment. I have been heavier, but this is my passion. Yeah.
Well, I thought this was your full-time job, so let's tell me, if you don't mind letting me know, what is your full-time job then, if this isn't?
Yeah.
I presume this was your full-time job.
No, it's not. I run the office for a lady, very talented lady who designs clothes. So she does wedding dresses, mother of the bride, etc. Okay. So I spend quite a lot of the day dealing with slightly hysterical people and trying to fix their problems. But luckily, it's only ever a sewing machine. It's only ever an alteration. It's never life or death. But so
it feels life or death to them, because my daughter runs a bridal shop.
Oh, yeah.
She says, like, it's life or death for the bride.
Yes. Yeah.
It's like that. Very good. So yes, you have a full-time job. I automatically assumed that this work that you do with the bariatric and plus size was your full-time job. So I'm glad we sorted that out. So you're a very busy person then.
Yes, I like being busy, but when I'm in my everyday job, nobody knows what size I am. I'm just the lady in the shop, and it doesn't matter. And that's how I kind of try and live my life, that size doesn't matter until it does. Yes. So there's only ever three sort of areas of life where it gets difficult, and they are clothing, but I work for a clothing manufacturer, so that's sort of sorted. Travel, which you can usually resolve with a bit of thought and planning, and healthcare. And that's the only one that really matters, because that's the life and death. That's the one that matters.
So obviously healthcare we're going to concentrate on today, because anybody listening that doesn't know, I am an occupational therapist, and I founded the company Seating Matters. And what we, over the years, we have been trying to accommodate all people. And as we talked about earlier, we said there's no limit to the care that we as OTs provide. There's no limit to the care that a nurse would provide. So there shouldn't be a limit to the equipment that's available for people of size and for all people with different disabilities. So first of all, what were the challenges? And no, let me start. Why did you decide to become an advocate?
I think it sort of chose me, really. I was working as a plus size model, as a part-time job, and I was hired by one of the major manufacturers in the UK to be a demonstration model. It was a lovely lady there who I'm so grateful for asked me some questions, and I started to think about my size and getting the opportunity to talk to an audience who were very interested in the lived experience of the larger person. And this it's over 20 years ago now, and it's sort of built from there. I speak on my own behalf, obviously, but I also speak on behalf of an online community of bigger people that I belong to. They frequently remind me that I'm not the elected representative, so I try and make sure I give my view and theirs if we differ. But yeah, it's just really the chance. I'm so grateful for anybody who is interested in bariatric care. because obviously I have a personal interest. But, you know, statistically, the number of bigger people out in our community is growing. Now, I'm not an advocate for being big. I'm not an advocate for putting weight on or for not caring about your health. But I am an advocate for being responsible for your health and proactive. And it's about equity of care. So there's no point in giving everybody the same chair and saying we fix this problem. Everybody needs the chair that is appropriate to them. And we need to, you know, if I fall ill, I need proper care and good rehab to get me back, because, you know, I'm somebody's daughter, somebody's sister. I work work full time. I'm a taxpayer. I'm a voter. I have the same right to equitable healthcare as everybody else.
Yeah. So before we go into the challenges that you face, could you tell us how you've got to this point where you have put on the weight? Like, what do you think was what caused it? Just so we get a wee bit to know about the person, because as you say, you're a real person. You're a daughter, a sister. So tell me, like, how did you get to this point?
That's a really interesting question, and every bigger person you ask will have their own very unique story. For me, I come from a thin family. I grew up relatively skinny. I, you know, was outside all the time. If it wasn't horse shaped, I wasn't interested in it. Basically, as I grew up, then as a late teenager, I developed sort of mild depression, and sort of comfort eating developed a bit. Through my 20s, I put some weight on, but then just as I turned 30, my then partner died suddenly in an accident, and my slight tendency to overeat just completely became out of control. So I still have sort of obsessive compulsive things. I do lots of counting and lots of weird sort of mental exercises, but the weight for me was a result of poor mental health. And although you know, I'm 58 now, so that's 28 years ago that it happened, even though my mental health is pretty good now, the weight remains. So one thing I'd like to sort of say to the audience really is, you know, if I had taken comfort from drugs or alcohol, the second you stop taking the drug or the alcohol, your health automatically starts to improve. If you're an overeater and have put weight on and you stop overeating, your weight stays the same. You have to actively manage it and be in a calorie deficit every day. So on a good day, I manage that, but on a bad day, I don't. I have been.
That, like, do you go to anybody, like a psychologist or anybody? Do you go to anyone to help you with that? Because that's a struggle. I mean, I can identify with that. That's a struggle you have every day.
Over the years, I've had some really good GPs. I have to say, as a larger person, you sometimes have to work quite hard to develop a good relationship and make it clear that you're not going to have every complaint written off as just, well, that's to do with your size. I don't see anybody now, but I think my friends and family, I've got a fantastic support network who help keep me on the straight and narrow. For me, a good day is if I finish the day at the same weight I started. That's good enough. If I lose, that's fantastic. That's what I'm wanting. If I gain, I have to have a really hard conversation with myself about what triggered the obsessive compulsive eating and how can I manage that better going forward.
Do you weigh yourself regularly?
Fairly regularly, yeah, about once a week. For years I didn't. I didn't want to know. And then I think I reached the realization that the number on the scale tells you of the effect of gravity on my body. It doesn't tell you my worth as a person. It doesn't tell you anything about my health. It doesn't tell you about my mobility. It might tell you whether I'm suitable to sit in a chair, but it doesn't say that the chair will automatically fit me in terms of width or height or depth or any of those. I think we kind of need to, if somebody took my blood pressure, and I'll say now my blood pressure is fine, I'm not diabetic, I'm not pre-diabetic, but if somebody took my blood pressure, I wouldn't hear the number as a moral judgment. It's just a fact, and I try to feel the same about my weight. So believe it or not, I still have days when I feel fat, and I have days when I feel great. I've lost about 45 kilos from when I was at my heaviest, and that journey is continuing. It's a ongoing struggle. Yeah,
it is an ongoing. Everyone has ongoing struggles, though, don't they? Like,
absolutely.
Everybody in life has ongoing struggles. Yours happens to be your weight. Other people have different struggles, so we just have to be compassionate to each other, and not allow how someone looks to determine how we treat them. So tell me, just speaking about that, tell me about a bad experience and a good experience that you've had because of your weight. Tell me, first of all, like when you felt you weren't treated with equity.
I'm pretty good at standing up for myself, but in a healthcare situation when I'm not feeling well, I can't advocate for myself, just like lots of people struggle. But I can tell you, I was in hospital and I was, excuse me, I was recovering from a hernia repair operation. And my surgeon came around and said you can't leave until you've had a proper bowel movement. Doctors are always obsessed. Nurse, everybody's obsessed when you're in hospital. He said you need to start eating, and I hadn't eaten for 2 or 3 days, so I thought, okay, I need to make the effort to eat something. The sandwich trolley came around. And I said, it's an NHS hospital, I hadn't booked any lunch. And I said to the assistant, could I have a sandwich, please? And she said, yes, the low-calorie ones are down here. And immediately that was like a shock to me. And I couldn't advocate in that moment for myself. I couldn't say, why do you feel the need to give me that information? I haven't eaten for 3 days. I'm following doctor's orders. Do you think what you just said to me was helpful? Instead, I immediately said, oh, I'll leave it, thanks. And I didn't eat anything until the next day. So that's just like a tiny little hiccup. And I believe in trying to be kind to everybody. So I choose to believe that the woman who said that to me was trying to act in my best interests and was coming from a good place and trying to think of my health. But it was the wrong thing to say at the wrong moment. She wasn't qualified. She didn't know anything about me. But I wish I tackled it differently.
That's what I would like this recording and this podcast or this interview that we're to highlight how important it is to speak properly to people, to be aware, of how you speak to someone. Because that's so important, and especially if someone of size, because you obviously, people like that, you may feel a little bit like, your confidence mightn't be as good as other people. And when you're ill, your confidence isn't good anyway, even no matter whether you're plus size or not. So yes, how we speak to people is so important. Have you had good experiences? Like, for example, going into hospital, what about the equipment? What about the bed, the chair, the gown? Have you had good experiences, or have they all been less than good?
No. Compared to the average patient, I suppose, I'm very well educated on, hospital equipment and techniques and lots of these things. I've spent nearly 30 years now studying and trying hospital equipment. which has been an absolute privilege. The industry as a whole is so generous in trying to help people learn and understand. But believe it or not, my best experience to date was a couple of years ago. I had a colonoscopy. As I said to you, I believe in being proactive in your healthcare. So all of these nasty procedures that start, ideally that you should take as a preventative measure, I wholeheartedly believe that we need to do those things. Everybody should get all of the checks that they're entitled to. But I had a pre-op conversation with the nurse on the phone. And when we got to the end of the conversation, she hadn't asked about my weight. So I said to her, can I tell you, this is my weight. Does that cause you any concerns? Now, the way she reacted to that let me know that she already knew my weight and was waiting for an opportunity to talk to me about it. So we had a frank conversation about the things that might be different for me as a person of size. She told me the bed was no problem, the chair would be no problem, the procedure would be no problem. The one hiccup that we had was going to be the patient gown. So she said, I will have some alternatives. We can get them. It's not an issue. I will have some alternatives for you. And I said to her, is it okay if I bring my own freshly laundered gown just in case? And she was perfectly happy with that. Now, when I went to check in, none of the gowns she provided fitted me. But I was so thrilled that when I got there, the size, weight appropriate bed was there. These 3 beautiful gowns were sort of freshly laundered and laid out for me. Everything that she said she would do to make me feel comfortable, she went ahead and did, which is, there's quite often lip service without follow-up, but she followed up on everything. I wore my own gown. Nobody had a problem with that, and the procedure was fine, and recovery was fine. It was seamless, but I was so thrilled that she had taken something that anybody would be nervous about and treated me like any other patient, and made it a really positive experience.
Do you think we as healthcare professionals, or as people in general, are a bit afraid to approach the subject of weight to our patients, to mention it? Are we a bit afraid that we're going to offend?
Yes, Martina, that is spot on. I'm so lucky. Recently, I've had the chance to travel to America for conferences, Australia, New Zealand, talking to hospitals. And all across the world, the question I get is, how do I have this conversation? What words can I use to open the door so that the patient knows that I am understanding and have solutions I can offer if they can tell me what the problem is? Now, I have to say, the plus size community is not great at speaking up and saying, this is my weight. Can you reassure me, that you can deal with me, etc. So we, as patients, need to improve, but the healthcare industry as well. When you check into hospital, you get asked extraordinary questions about bowel movements and urination and your sexual history and all these incredibly intimate questions. But somehow we seem to hit a stumbling block when you have to ask us our weight. There's no reason that should come with any, judgment attached to it. It's just another measurement of health. So yes, the patients need to improve, healthcare needs to improve, everybody needs to just talk about the subject.
So what words are good and what words would you not want said to you as a person of size?
I will say you'll never find language that makes absolutely everybody happy, but there are words that you can use that will probably make the majority of people you address happy. I have no problem with the word fat, and my consultancy is Fat Lot She Knows. It doesn't bother me, but I would advise not to use that word unless you have, prior consent from your patient. I like it if people can say if they're doing a comparison, if you can talk about something of average size and not use the word normal. Mm-hmm. If you talk about what you would do for a normal patient, you make me feel abnormal, and I don't like that. So if you could make it talking about average size, that's a nicer thing. Okay. I refer to myself as a bigger person, a person of size.
Is plus size okay?
Sorry?
Plus size, is that okay?
Plus size doesn't offend hardly anybody, but having said that, I did have a conversation with somebody who said that's a female term and it's to do with fashion and it's nothing to do with me. He was a gentleman. And I said, okay, fair enough, what term would you rather I used? And he said, well, I don't know. Now, some people can be so sensitive about their size, they don't want any reference to it. But, you know, it's a fact of life and we need to address it. Mm-hmm. The one term that I absolutely cannot abide is morbid obesity. That is such an unkind description of somebody. It translates as dead fat. Mm-hmm. And, you know, when I'm in front of you at my most vulnerable and as a patient, describing me as dead fat is not acceptable. I can understand it has a clinical meaning and it can be used in a clinical sense, but it's such an unkind thing to say to somebody. We don't talk to anybody else in such horrible terms. There is still, unfortunately, a portion of healthcare who thinks they can scare or insult us into losing weight, but those aren't effective motivations. They're never going to work. You can't, to use a phrase that I recently learned, you can't hate somebody into behaving better. It doesn't work. It's counterproductive. So yes, if you could avoid normal, if you could avoid morbid obesity, that would be a start. And always I would advise patient-centered language. So person of size is probably kinder than bigger person. In our conversation, I call myself all sorts of things because none of them really bother me. I try and judge the intention behind it, but person of size, person living with obesity, maybe. They're terms that won't offend people, hopefully.
So as a healthcare provider and a healthcare manufacturer, we manufacture chairs and we also provide training. So how, first of all, about chairs, how have you found healthcare chairs, and what advice would you give to us as manufacturers when we are, because we're developing a chair at the moment for someone of about £1,000. It's probably not a chair we'll use a lot, but it has to be available. We have to, so 75 stone, I think, £1,000 anyway. So what, have you any advice that you could give manufacturers off stating, like how have you found healthcare chairs?
Over the years, I've had the opportunity to try lots of chairs, and I would think there's probably the right chair out there for everybody, but it's a question of whether your healthcare provider is well educated and can access the range of solutions that are going to fit everybody. Generally, I think manufacturers work on weight measurement, which obviously is a safety concern, but also for bigger people, you need to look at other measures. So how wide is the person? If you sit me in a chair that is very, very wide and I want to self-mobilise out of it, if the chair is much wider than my body and I use the armrests to stand, it's not actually going to help me, you know, it's not going to generate any movement. So a chair that is width adjustable, depth adjustable, ideally, would be a step forward. I can speak
we have a phrase that we use when we do our training. It's not just a bigger chair.
Yeah.
It's not just a bigger chair. There's so many other things you need to consider when you are putting someone in a seat. As you say, the depth, the gluteal shelf, all these, and the people's weight the people look different, like they have different shapes, so you can't. I think I've read somebody says one size doesn't fit all. Well, we say that about every chair, but like one size doesn't fit all, and it's not just about getting the right weight capacity for the chair.
Yeah.
So we are trying to work on that to make it better for people of size. Yeah. The other question that I was wanting to ask, because we provide training for manual handling training, and we're obviously getting more and more requests for moving people of size. So is there anything you could advise us to be that bit more aware of and sensitive to the needs of the person? Is there anything in particular that we should be thinking about?
I think, generally speaking, larger patients have a reputation for being difficult, and that can be difficult in terms of physically accomplishing a safe move, but also that we can be uncooperative. I think because when you navigate the world as a person of size, you have to be responsible for a lot of your own planning, etc. So if my friends say, hey, it's somebody's birthday, we're all going to this restaurant, none of my friends need to check that they will be able to get up the stairs and into the seat and to the bathroom. But it's me, I feel responsible. So I will Google and search photos and check that the seating looks suitable for me, and I will phone up and I will do all this pre-checking. So when you navigate life as a bigger person, you're used to being responsible for all of these things, and handing that responsibility over to a person or people who are not of size and who probably don't have any insight into how your body works can be quite scary. We have slightly different patterns of movement. Sometimes the way we stand and sit and move can be slightly different and slightly unexpected. Sometimes the visual observation. I've had people say to me, you look like you're tipping out of that chair. And I can say to them, no, I am sat perfectly balanced and comfortable. I could maintain this position for hours. But because my dimensions aren't what they are used to seeing, their assumption is that I'm falling out forwards. And if they don't have communication with me, they're going to lean me right back in the chair and run the risk of maybe slightly disabling some abilities that I'd like to be working on and developing.
Yeah. And do you find that you can find like an office chair that suits you? Like you say you work, obviously you work full time. You're probably sitting quite a lot, are you?
I am. It's a, desk-based job like lots of others. They're not impossible to find. The price difference can sometimes be slightly shocking because, I understand that there is an extra cost associated, but sometimes it feels slightly disproportionate. But, I live in an unmodified house. My house has normal furniture. I sleep in an ordinary bed. I visit my friends' houses, which all have ordinary furniture. I stay in hotels, which have standard furniture. Nearly everything is possible with a bit of forethought and planning. I find, in particular, fitting into cars can be interesting because the outside of the car has no indication of how well thought out the interior space is. So, I'm probably quite a good friend to have because I'll always volunteer to drive, because that means I can research the parking and also that I know that I can sit safely in the seat and the seatbelt will fit. You can't always predict what is going to work and what isn't, but if you can communicate with the person and trust that you are the clinical expert, but they are the expert in managing that body, then you meet as equals, and then it feels like a sort of respectful, collaborative approach to healthcare, which is much more productive, I think.
So when we do some training on bariatric, when we do our general seating training, and we learned this over the years from a research that was done in the United States, and they said to us that before you go to assess a bariatric patient, you need to think first of all that they've got a fear of falling, a fear that the equipment isn't going to meet their needs. And maybe when you take away the blanket off the bed or the whatever, that the gown isn't fitting properly. So you need to be aware of that, and that there's an embarrassment around that. And that's things you need to consider, maybe more for someone of size than you would for, as you say, the average person, because the gown probably fits them. They know the equipment's been used every day for all these other patients on the ward. They see them being moved, they see them being lifted, and they know that they're okay. But when you're a person of size, you maybe didn't see anybody in that hoist, on that bed, in that chair, so you have a fear that might not. So I think that's something that we use when we're doing our training. Would that be something that you would agree with or resonate with?
Yeah, I'm slightly saddened that the assumption is that somebody of size would be embarrassed by it.
Yeah.
I accept that lots of people of all sizes have...
embarrassed by the fact that when the gown doesn't fit, not necessarily by their size, but embarrassed that the gown that someone give them doesn't cover them, that sort of thing.
Yeah, I think I refuse to feel embarrassed by my size. I'm embarrassed by my lack of personal organisation. I'm embarrassed by the fact I can't seem to park my car very reliably, but my size, I refuse to be embarrassed by it. I will just say that. But I think if you can just approach each situation as an individual one, and if you can have a one-to-one conversation. So even if you're going to be doing some kind of manual handling that involves maybe 2 or 4 people, have the planning discussion outside of the room before you go in, and then have one person enter the room and say, this is what we're going to do, this is how we're going to do it. We're fully trained, we do this a lot. Do you have any specific concerns you want to share with me? I'm a huge fan of universal equipment, so I understand that it's not always economic or practical, but it would be fantastic if every single hoist, for example, could handle every single person. No, that's just not possible, but pieces of equipment that can be used for patients of any size take away any sort of discrimination and stigma and bias. If somebody says to you, we can't use the ordinary lift, we've got to get the special one, that can feel discriminatory and uncomfortable. Engineers and sometimes marketing departments love to call their equipment things like the Goliath or the Titan to indicate that it's very strong. But if you're the person in the lift and it's saying that, it can be devastating. So I would appeal to anybody who's launching equipment. I love you for your flexibility in thinking about giving us more equipment that's suitable for people of size, but please think about the name and how it feels when you're using it.
It's true. That's very important. Like, that's something probably that manufacturers and marketing people haven't thought about. They've just thought, what would be a good name for this to show that it's a strong piece of equipment, and then they haven't really thought about the impact that would have on the person using it. Yeah. So we talked a bit about Tracey, about manual handling. We talked about seating, and the other thing that as OTs that we are really involved in is bathing and hygiene, and looking after personal care and trying to make people as independent as possible around their own personal care. Have you any tips there with regard to how we should approach that with our patients, or any experiences maybe that you've had with regard to that while you were a patient?
Yeah, I know that when I enter any situation, I will be examined, I will be looked at very carefully, and that's for every situation I find myself in. But it's particularly key in healthcare because I want to make sure that I am my opinion is respected and that I'm listened to. And I think as a bigger person, that's not necessarily an automatic. So for me, that means I like to be professionally presented when I have any kind of interaction with clinical staff. So I don't advocate this at all. This was probably dangerous behaviour, but I was suffering from what turned out to be appendicitis, and I called my GP surgery, and my lovely GP said to me, yeah, I think you need to go straight to A&E. Do you want an ambulance? And my other half said, no, I'll drive, it'll be quicker. So I said to him, fine. He was literally stood with his car keys in his hand, and I said to him, just give me a minute. And I went and I had a shower, and I put on makeup, and I put on a posh dress, and I got my best handbag. And he said to me afterwards, he was literally pulling his hair out, thinking I was having a mental breakdown. But I am convinced that the way I present myself when I meet healthcare professionals is judged on the way, how seriously I take myself. And I wanted, I wanted to be listened to. I wanted to be respected. I wanted dignified care. And I think looking after myself is the first indication that that is my baseline. So as I said, I don't advocate it at all, but I do not, nip to the supermarket in my pajamas, or, I'm afraid my lipstick is armour for me.
You're judged like as being, because you're off size, that you're lazy or not motivated, or is that the impression you think that people have?
Absolutely. This stereotypically, the words that go with fat are fat and lazy, fat and stupid, fat and smelly. In my opinion, I've met lots of thin people who could fit into,
all those categories.
Yeah. We all have bad days, etc. But I don't want to feed any stereotypes myself. So for me, personal hygiene is really important. And laying in a hospital bed and, the sponge bath is embarrassing for somebody of any size. It's a very strange experience. But there are so many useful aids on the market. And why am I telling you, Martina, you're an OT, you have seen every kind of aid. But the truth is that, one size, again, doesn't fit all. If you can work with your client and say, I can get you any of these, which do you think would be helpful for you to maintain your own hygiene? That's helpful. There's some really inventive things on the market now which are genius.
So we are getting better, but it's like a lot of things, we still have a long way to go. And people like yourself who are advocating for people of size, it's so important to give them the confidence to speak out for themselves. They maybe don't have the confidence that they should have to ask for what they need.
Yeah. If I think when it really comes down to it, though, would we expect a patient of average size to say, this bed doesn't work for me, can I have another one, please? We don't expect patients of average size to need to be educated in what works. This is a slightly horrific example, but I was left on a hospital trolley once for 17 hours while the hospital tried to find a bed. Now, I knew at the time that the hospital was under contract to a bed hire service, but I would think the problems were probably about who could make the decision to get the bed delivered or which budget it came out of, etc. But the service was available, but nobody seemed to know how to access it. Things like that shouldn't happen. Every hospital, every healthcare facility should have a plan on how to handle a patient of size. Nobody thinks being my size is ideal or should be encouraged, and I believe that myself. But there's nothing I can do that's going to drop 50 kilos to make me convenient to be handled. So every healthcare facility should have a policy in place, and maybe a local champion or something who is very well educated, who can disseminate information.
Mm-hmm. Well, Tracey, I want to thank you so much for coming on, because you are one of those people that are going to change people's lives. Like, you're having a big impact. And I know you probably, like myself, get a bit frustrated when you say you're doing this for the last 20 years or more, and still you coming across these daily problems, and you're probably a bit frustrated why we're not getting this message. But that's exactly how I feel about Seaton. I've been doing this for 40 years and I still get frustrated. But we can't give up. We have to just keep going, and every one person that you help is going to make a big difference to their lives. So I want to thank you for all the work you do, and please keep it up. And if we can work together to get that message out, that's something that I would really love to do.
Oh, Martina, thank you so much. And I have to say that, the healthcare industry is so generous in the way people share expertise and knowledge and work together. And I have no clinical qualifications, and I'm so grateful for people like you for leading the way and for showing us that improvement is possible and can be achieved. So thank you so much for this opportunity.